Good afternoon, everyone, and thanks for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Minister responsible for Rural and Remote Health, Warren Kading. Joining us over the line is Dr. Saqib Shahab. I believe both the Premier and Dr. Shahab will have brief opening remarks, followed by time for questions.
Premier? Yeah, you want some opening remarks? Okay. Well, good afternoon, everyone, and thank you again for joining us here today. Today we are reporting 31 additional cases out of 1,613 tests that were completed yesterday. Again, today the majority of the new cases are in a number of our Saskatchewan Outbreak communities. The Minister of Health and the Saskatchewan Health Authority continue to work closely with the Ontarian Safety Council as well as leaders in individual communities to address this situation. I'm joined today by our Minister of Rural and Remote Health, Warren Kading, who has now spoken to many community leaders across Saskatchewan. And he reports strong cooperation in taking the actions that are necessary to control the spread of COVID-19 in those communities. We are working together to increase public awareness in these communities, to ensure everyone is aware of the public health guidelines and the safe practices to protect themselves and to protect others from the spread of COVID-19. We are working together on aggressive on-site testing and contact tracing in these communities, and ensuring those that test positive immediately self-isolate and, if necessary, receive medical attention. We are working together to ensure anyone with COVID symptoms and anyone who has been in contact with someone who recently had COVID immediately seeks and receives a test. In the coming days, public health officials will visit every Outbreak community in the province to inspect compliance with the public health orders, to offer testing in the community, and to offer any other supports in the community, much like we have in other areas of the province. We will be ensuring that the public health order limiting gathering sizes to 30 people is being followed in all instances. And we will also be ensuring that any affected communities are restricting non-essential travel into and out of the community. And as I said, Minister Kading has observed this to be the case. To be clear, we have been receiving strong cooperation with many of the communities already. But halting the chain of transmission requires a 100% compliance across the province. So we are working together to ensure that that is the case. On when to test, if you ask yourself this question, I would say do it as soon as possible. If you're experiencing any symptoms at all, or if you've been in contact with someone who is tested positive, go get tested. Dial 811 and follow their directions immediately. It's always been beneficial to identify if you have COVID prior to spreading it to a family member, to a friend, or to others in your community. This is a very serious situation in these affected communities. These are small, tightly knit communities with, in some cases, relatively large numbers of infections. However, we are confident that through public education and strong voluntary compliance with all of the safety guidelines by community members, that we will be able to contain the current outbreak and see these case numbers begin to decline. This should also serve as a reminder to all of us as to just how quickly this virus can spread. I know that we are all suffering with some level of pandemic fatigue. And most of us have probably been a little less careful as of late than we were, let's say, back in the spring. That may be why we are seeing a few case numbers starting to creep up again in some parts of the province as well. I don't think it's any cause for alarm just yet, but it's a clear reminder that the risk and COVID-19, it's still here. We cannot let pandemic fatigue undo all of the progress that we have made so far. So let's continue with our physical distancing. Let's continue to avoid large gatherings. Don't have too many close contacts outside your virtual household. Continue to wash and sanitize your hands and do it often. When physical distancing isn't possible, put on a mask. That's how we are able to control the spread. That's how we've been able to control the spread. That's how we will continue to keep ourselves and others around us safe. And that's how we will get these case numbers going the other direction and dropping again. We've done it before in this province, and now we need to do it again. Dr. Shahab?
Thank you, Premier. So just confirming, can you hear me?
We can hear you.
Thank you. So I'll just go over some further details. So since the last media update on July 22nd, We now have 179 new cases of COVID-19 in Saskatchewan, bringing the total to 1,209, out of which 307 are active. Investigations completed so far have found that since July 22nd, 124 cases have been in communal living settings, but a significant number have also been out in the general community. So this just reinforces the fact that we really are not any longer in that 0 to 5 cases a day range out in the broader community. We are in that 5 to 10 cases a day in the general community. There's no specific trends that stand out, but we always knew that as we start traveling more interprovincially, certainly we will see the occasional case linked to interprovincial travel. And that's especially true when groups may rent out or live as a group overnight when they're not part of an immediate household. So just some precautions when we're traveling interprovincially for work or pleasure. We also have heard reports anecdotally of people enjoying a drink or in a restaurant where they may be sharing a drink or sharing food. And we just need to be cautious that even if we're going out and enjoying an evening out, we still need to abide by the guidelines. And even within our group, if you're not from the same household, not share drinks or food, and, do what we can to reduce what is still a fairly low risk of transmission, but certainly an increasing risk of transmission in Saskatchewan. And this is really important for us to continue to enjoy everything we are enjoying in terms of recreational activities, as well as continuing to engage in work, that as we reopen, we must follow physical distancing, staying home when we're sick. We need to reinforce that. We have had reports where people have gone to work while unwell or have gone out and engaged in economic activities or social activities while unwell. And again, it's to reemphasize that at the slightest sign of symptoms, any symptoms, stay home, call 811, get tested. This is extremely important. And as we enter into the fall, we all must have 1 or 2 masks for every member of the household that we can use. And I would really encourage everyone, whenever we go indoors to shop or in an indoor area where there's other people around, just to put on that mask and really get into that habit of wearing a mask. I think that'll serve us well in the fall. And really, we should really recognize many of us who are already doing that. And I think that's an example we all need to follow more and more. Thank you very much.
Thank you, Doctor. Thank you, Premier. We'll now take questions. Our first question on the phone line.
We have Adam Hunter with CBC.
Hi there. I'm wondering, we have some rising cases, as you mentioned, without links to travel or community within the community close contacts, and there haven't been any public health changes yet. I know, Premier, you just said that this isn't the time for alarm. I'm wondering if you're considering or what point there would be further restrictions on gatherings or businesses, travel, those sorts of things, because we have now our last few days keep making a new high in cases.
I would just a couple of comments, and then Dr. Shahab will have some comments on this. But the many of, not all, but many of the numbers that we are seeing over the course of the last number of days are not related to the Reopen Saskatchewan plan, are not related to businesses being open across this province. That in no way diminishes the seriousness of the current outbreak that we have, and the hard work that we are doing with community leaders, and more importantly, the hard work that community leaders and the individuals in those communities are doing to stop the spread, with some success in some of the earlier areas where those outbreaks have occurred. So we're not considering at this point in time what, if you're asking if we'd back up, if you will, on the Reopen Saskatchewan plan, there are other things that we can do should we need to, and I don't believe we're at that point in time yet. There are other things that we can do as we understand this virus better as time goes by. For instance, you're seeing conversations all over the world around mask use and appropriate mask use, and at what time, at what point in time should you increase mask use in the indoor settings, and So there are a number of things that we can do that have a much lower impact on businesses that are operating, a much lower impact on many of the day-to-day activities that we enjoy. Schools, for example, schools reopening, and we'll be making an announcement next week with respect to schools reopening and some of the measured actions that we have in place to ensure that will occur safely, and what actions may need to occur if we have some regional challenges or regional outbreaks in that case. But Dr. Shahab, would you have a little bit more specifics? We were just talking about specifically this, some of the actions that may be available.
Yes, thanks. So, the exposure settings seem to be pretty diverse, but not unexpected. So, for example, interprovincial travel is coming up as a regular, event. Every 2-3 days we have 1 or 2 cases linked to interprovincial travel. But we already know that many people are traveling for work or leisure, so we would expect to see that. But then we just need to consider, why are we traveling? How can we maintain physical distancing wherever we are going? And if we are traveling where the meeting with people who are not part of our immediate household or virtual household, how do we really maintain that physical distancing? That's number one. And secondly, we don't really see associations generally with retail activity, shopping. We think we're doing that really well. But again, it's just reinforcing the discipline we need to observe, because occasionally we hear anecdotally that people were crowding together in an aisle or chatting with each other in an aisle, and that's really not something we want to encourage. You really want to have the same discipline we've been showing for many months about going, getting what you need, coming back, and of course using a mask when indoors. I think that's always an additional layer of protection for us as well as people who work in the retail environment. Wearing a mask is considerate because it protects you, it protects people around you when you can't always maintain that 2-meter distance. And then finally, it's the familiar settings where transmission happens. So we need to keep our virtual household small, the same people. And as we are meeting more friends and acquaintances, it is hard to keep that distance when you're having a barbecue or meeting people socially outside. But I think that is going to be essential, to keep, everything else going and open. We have to sacrifice something, and it's those social gatherings where we come closer together than we should, where transmission happens, that I think is where we need to continue to be very vigilant. And it's very hard for all of us. We love to socialize around food, drinks, but I think that's an area where we'll have to keep our, close contacts, our virtual household small, the same maximum 15 people, and 15 is the maximum. If you want to keep it smaller, that's even better. And then if you are meeting people socially outside of that, wear a mask, keep that physical distancing, and that will be essential going forward. But obviously, we'll continue to track the settings where transmission happens and keep providing that feedback. Thank you.
Follow up, Adam?
Yes, I'm wondering why the government's decided to identify the cases on Outbreak colonies. Manitoba has made that change to not do it, and I know some of the leaders were frustrated by that. So is there a reason why or why not to identify cases on colonies?
Dr. Shahab, do you want any comment on that, and then Warren and I might have a comment?
And so maybe I can start. And I think the challenge, of course, was that, we were down to 0 to 5 cases a day. And then while we have gone from 5 to 10 cases a day in general settings, we do see an additional maybe 15, 20 cases a day, sometimes a bit more, sometimes less, in communal living settings. So it was important for us to explain that. I don't think we could have just said that we are seeing an increase in case numbers overall. But at the same time, I think it's very important to recognize that there'll be different settings for transmission. Sometimes it'll be in barbecues, sometimes it'll be in communal living settings, sometimes it'll be in places of worship or at funerals. We need to identify the settings and then address them in that context, but certainly not point fingers at a specific cultural group. Or I think it's the setting that results in a transmission, not who people are and what their cultural practices are. And I think that's really important going forward.
I think this mirrors what we did in the northern communities as we clarified and identified the outbreak that we had in and around the Losh and the surrounding area of Clearwater, Denny First Nation. And as the numbers do increase, it's not our intent, and Dr. Shahab is right, is to create that opportunity for stigma. We should actually, stigmatizing any people or population here in the province, we should actually applaud those that get tested and get tested early. That is how we control this virus, is by early identification and then doing our ambitious contact tracing and ensuring that we isolate those that test positive. And I would, just step forward and say thank you to all of those people across Saskatchewan, including those in Hutterick communities that are stepping forward and getting tested early. They are doing not only their community a great service, but they're doing this province a great service when they do that. And we should not stigmatize the numbers that are being presented day by day. Those numbers are the result of people doing the right thing, people putting themselves forward to be tested, and for that I say thank you. That is how we will be able to take those numbers and turn them in a much different direction. That being said, the numbers are, this outbreak is quite severe. We have across this province a little over 6,000 Hutterite members, Hutterite community members. They're our friends and neighbors. They're my friends and neighbors where I live, but this is a severe outbreak. If we approach 300-400 individuals that would be identified positive in the coming days in those communities, and we may. We're looking at a 4, 5, 6% infection rate. That's a tremendously high infection rate. It's something that we're taking very serious. It's something that Minister Kading has worked very hard on in reaching out to the individual community leaders to ensure that they have all of the public health information that they need around the recommendations that Dr. Shahab and his team have made, and to encourage community members to follow, to comply with those public health recommendations, the public health orders that are in place. That is how we stem the spread of COVID-19, whether you're in a Hutterite community, whether you're in a northern community, or whether you're in one of our cities. The prescription is exactly the same, and we are seeing some of the earlier cases, some of the earlier communities are now on the backside of their infection. They have made the appropriate steps, and they are starting to step toward not having any active cases in their community. And for that, we thank them and commend them as well.
We'll take our next question from the room. Dan?
Yeah, hi, Premier and Minister. What's your response to Northerners who see this as saying, well, we were in a lockdown, and in many communities there were 0 cases, and we were in a lockdown, but there's no lockdown of the Hutterite colonies. What's your response to that? Do you think that's a double standard?
Not at all. We're approaching this in precisely the same way that we did in northern Saskatchewan, and Minister Kading will speak in much more detail. But as we clarified where the cases were in northern Saskatchewan, we shrunk the area that was being impacted by travel restrictions. Those began through collaborative conversation with the northern communities on self-imposed travel restrictions, which is where we're at right now with our Hutterite communities across the province, understanding they're scattered around a little bit more than we were in the northwest. So it was done. The decisions that we made in northern Saskatchewan around travel restrictions, around supports for the community that we brought in to the community, are very similar conversations as we're having with our Hutterite communities and the leadership in our Hutterite communities, whether they're self-imposed travel restrictions, which are occurring now, and Minister Kading can speak to, or whether there are different supports that our Hutterite communities do require, and we're in this together. The virus really doesn't care whether you live in northern Saskatchewan in a Hutterite community or in one of our cities, and it's our job as government to support each of these outbreaks in any way that we can, and to provide and fill the gaps as they arise. But Minister Kading, do you have anything to add to that?
Sure. No, I would say we've had a very similar engagement with local leadership as we did with the North. If you remember, local leaders in the North put up check stops originally, and then asked us eventually to take those over and help manage the movement in and out of their communities. And that's what we're finding with our Hutterite friends now as well, is that they have put a lot of their colonies on voluntary lockdown. absolutely eliminating anybody traveling into the communities. Signs and restrictions at the gates, just asking that no visitors are allowed at this time. Talked to a few colonies this morning that said when they've got trucks coming in to pick up produce or to pick up animals for market, the drivers stay in the vehicle, do not exit that vehicle. They're not in contact with with members of the colony there. So there's a lot of self-imposed isolation as well, that they're not allowing any of their members to go into communities, and certainly not going into other communities, other Hutterite communities, or into town as we would have it. And it's really a self-imposed lockdown as well. And also supporting us that if we need to, if some are maybe not reacting appropriately, that we take the necessary actions that might be needed to get them to.
Follow up, Dan? Nope. We'll take our next question from the phone line.
We have Phil Tank with the Star Phoenix.
Yes, I'd like Premier Moe to clarify what he just said about cases that we expect in the coming days. I didn't quite understand exactly what he was saying and where that information comes from.
Well, as we continue with what is a very aggressive testing effort, similar to what we did in La Loche in our Hutterite communities, I don't know, but we could expect that there will be additional numbers as we work very closely with the communities. I'd said in my opening comments that public health will be visiting all of our Hutterite communities across the province to disseminate information, but also to support the community in anything that they may require, and also to provide testing where that is required or seemed relevant or desired. So as when we test more, and we are testing more today, we are going to find more cases, in particular when that testing is very much targeted to an area where we know we are having some challenges with respect to an outbreak. So I don't know that we will have similar numbers in the days ahead, but it wouldn't be unexpected. There is a lag to how this virus works, a few day and sometimes a week or two lag with respect to the numbers. You may have one infection in a community that turns into 5 or 6. That takes a week or 10 days or 2 weeks, and so you do have a lag with how the infection works. So I would say that we may have these continued numbers for some period of time. You may even have these numbers for some period of time after many efforts are put in place. With that lag effect, you may have efforts that are put in place in a community to stop the spread, and you may actually successfully stop the spread of COVID-19 in any area, but in this case, a Hutterite community, and then still have an increasing infection rate for the next 7 to 10 days, for example, until you actually start to climb down the backside of that. So, that's what I meant by that, to clarify, Phil. I hope that answers your question.
Follow up, Phil?
Yeah, I guess this is for Minister Kading. I'm just wondering, with the conversations you've had with Hutterite communities, what sort of approach are they taking to communal activities like eating and church services and stuff like that? Are they staggering them? Have they discontinued them? How does that work in a communal living setting?
Well, first off, I'd like to thank our Hutterite leadership for the respect that they've shown to SHA officials, and they've had tremendous dialogue, sometimes on a 2 or 3 times a day basis with SHA officials, just to get a better understanding of how they need to cope with this virus once it's in the community. So our officials are spending a lot of time providing guidance and giving them direction as to how to prevent the spread of this virus through the community, and that involves working with those that test COVID positive. I know I had 2 or 3 colonies indicate that honestly they're feeding mum by sliding food under the door, right? So they're taking it very seriously on self-isolating positive residents in their communities. But I'm also seeing some very creative work that's being done between our Hutterite colonies and with community leadership as well. A lot of curbside pickup and curbside drop-off when it comes to parts, or supplying pharmaceuticals from the local drugstore, or even groceries if they need to go in and get supplies. We see a lot of colonies now have absolutely eliminated travel between colonies, and certainly limiting the number of people that would go to town to be responsible for doing a certain errand or a chore. We're seeing post offices leaving mail out at the curbside, waiting with contact by the colony member, just saying I'm coming to town for the mail, and it's left as a curbside pickup. Again, very innovative in the colonies themselves. A number of them told me that, they've got a lot of equipment on these colonies. It's one operator, one seat. They're not exchanging or allowing any other members to go to operate a vehicle. It's simply one person operating one unit. So they're minimizing any risk of spread or transmission through that. They're very, very willing to try and understand how they can reduce this, because they see what it does in their communities as well as in communities around them. So I would like to applaud all of them for the efforts that they've taken to reduce the harm within their communities and outside.
I would just add to that. I've talked to a few leaders as well, and one thing I think we should all understand is there are many colonies that don't have any active cases, don't have any cases, and they also are part of this conversation on how they can keep COVID-19 out of their community, like every other Saskatchewan community is as well. And just like every other Saskatchewan resident, Saskatchewan family, Saskatchewan community, our Hutterite neighbors are coming up with some very innovative solutions on how they can stem the spread in their particular environment. Specific to mealtime, for example, there's some staggered mealtime. I've talked to some leaders that are staggering their mealtime as well, as provides opportunities for physical distancing at mealtime, as well as many Hutterites, like many Saskatchewan and Canadians, are religious people and abiding by the public health recommendations when it comes to our religious services, our church services and such, and that is occurring in many communities. We need to ensure that it is occurring in every community, whether it's a Hutterite community or not. Saskatchewan, our public health will be reaching out and working with disseminating that public health information with respect to the recommendations that are there, so that everyone is very clear in their understanding of the public health recommendations that are there. And it's our hope and actually our expectation, and it's and we do expect that the voluntary compliance will be there, like it has been for the most part by the vast majority of Saskatchewan residents. And I think back to our outbreak that we had in a northern community, an area of La Loche. There's no way that we would have been able to get through that, and we are through that outbreak, without the voluntary compliance of the vast majority of people in the community of La Loche. There are very low case counts, if any, at this point in time in that area, and that's due to the hard work and the adherence to the public health recommendations by all of the people in La Loche.
We'll take our next question from the room, Steph.
Yeah, this is to the Premier. Why haven't you made masks mandatory yet in indoor spaces, as Nova Scotia is just the latest province to do so and they have 0 active cases?
Right. Well, Dr. Shahab, you may want to follow on this as well, as we take our advice with respect to things like mandatory mask usage and whatnot from public health. This is a conversation that is escalating across. I see it escalating across Canada. I see it escalating in this province as well. Where we have been thus far is that we would ask individuals that if they feel that they are more comfortable wearing a mask, that they wear a mask, first of all. But if they are unable to truly physical distance, like we are in this room, that they should wear a mask to protect not only them, but to protect those around them. There may be a point in time, either on a regional basis or maybe even province-wide, where we will have to go to wearing masks as a mandatory measure. I would far sooner want to have that conversation prior to shutting down sectors of our economy. That is a way for us, as we understand this virus better, to ensure that we don't have to shut down the sectors of our economy. There are already areas in the province where we have made mask wearing mandatory, for instance, in our healthcare settings, in our long-term care homes, as well as a few other areas across government as well. So it's not mandatory across the province at this point in time, but it is mandatory in certain facilities in the province at this point in time. And as we see over the course of the last number of days, things can change very quickly in certain areas of the province, and we need to be ready to react. And it's always one of the tools that we would be able to use. Dr. Shahab, would you have anything to add on mandatory mask usage?
Yes, thank you. I'll just add that, even in our personal care services, hairdressing, other, mask use is required in those settings by individuals providing care and by individuals seeking care when you can't maintain the 2-meter separation. And we've already seen the benefits of that, and there's been numerous studies that have been published now that show that even when you wear reusable cloth mask in those settings, even if inadvertently a person providing care was sick with COVID and didn't know it, or a customer was sick, transmission is unlikely to happen. So we definitely know the benefits of mask use, reusable cloth masks when seeking personal care, and obviously medical grade protective equipment in settings where healthcare is provided. And we increasingly see more and more people wearing masks when they're in indoor spaces like shopping or other indoor environments, going to an office. And we just need to make sure that all of us have a mask on hand and we increasingly start putting masks on in those settings. I think we all need to just practice this as a behavior now for the next weeks to months. Not all the time, certainly when we're in our own car with our own household members, but if you have to travel with someone who's not part of your virtual household, everyone in the vehicle should put a mask on. If you're, going into an office, it's considerate for you to wear a mask on. Most businesses you go to, staff are wearing a mask, but if you put a mask on, you're showing consideration for people who are working there as well as for others. And we really need to make that into a habit. Have a mask on hand and put it on where required. Thank you.
Follow-up, Steph?
Yeah. If we know the benefits of wearing a mask, we see an outbreak happening in this province, you're asking people to wear a mask when they're not able to physically distance to the required amount. What's stopping you from just making them mandatory and removing the possibility that someone may just feel like not wearing one because, as you say, Premier, there is a bit of COVID-19 fatigue? So what's the hesitation here?
Nothing's stopping me from saying that we may have to go to mandatory mask usage at some point in time. What we have not made that decision as of yet, and Dr. Shahab, you may add into the details of this. We understand the current outbreak that we have. We are working very closely with what is driving that particular outbreak. And that isn't to say that we aren't working with mask availability, mask usage in the area and the confines of the communities where we are having this current outbreak. But the other health measures that we have in place in the vast majority of the geography of this province, for the most part, seems to be successful. We have fairly low numbers here in Saskatchewan. We have fairly low numbers because of people's general adherence to the public health guidelines that are in place. The physical distancing that is occurring, the hand cleanliness, the washing your hands using a hand sanitizer, people adhering to the number the number of people that are in their, not only their virtual household, but the number of people that would be attending a larger gathering, and keeping that number as low as possible, and certainly keeping it within the 30 that is recommended by the public health order. The people of this province can be quite proud, I think, of what they are collectively doing by their personal adherence to the public health orders. So it's not to say that it won't be part of a recommendation at some point in time. It may be part of a recommendation in another sector of society. But it may even be part of a more broad-based mandatory mask usage. But no one, in the same way that we don't stigmatize any individual in this province, the same holds true for mask usage. We were talking about it today. We're seeing mask usage in numerous rural communities. I was home on the weekend and see numerous people that are wearing masks, and I commend them for doing just that. I carry a mask with me as well. Many, I think, of our colleagues do as well, for those instances where you may be in a public setting where there are a number of people who are just not comfortable with the physical distancing that is made available to you. So it's not a mandatory mask usage as of yet. It's not to say that at some point that it won't be. Dr. Shahab, anything else on that?
Yeah, I mean, all I'll add is that, I think the first step really is that we all have a mask on hand and put it on. And I think all of us should now start to, at least as we're out and about, be able to say that, yes, we did go into the indoor setting and we put a mask on. I think if all of us can do that and say that, we're well on our way to having, more regular mask use in indoor settings. And like the previous said, if you continue to see an upward trend, then as we move indoors in the fall, there's a need to make it, a requirement, especially in specific settings where, members of the public are accessing services. That certainly should be an option. Thank you.
This is a good discussion to have. I had said in my opening comments, I'd referenced pandemic fatigue. We don't have weeks ahead of us with this COVID conversation and adherence to these guidelines. We have months ahead of us, quite likely, and that's important for us all to remember. We have a great summer. The weather outside this week is absolutely fabulous. I hope everyone has the opportunity to be outside as much as possible with their family and enjoy the great Saskatchewan summer that we have. But we're going to go back in. It will get cold again, and we're going to go back to spending much of our time indoors this fall. And that is when we really need to be very, very careful with the public health guidelines, the public health recommendations that are there to ensure that we don't have some challenging numbers as we all venture back inside this fall. And that may be a conversation where we're maybe a little more aggressive, if you will, with respect to the recommendation around mask usage, a little more, current with the conversation around, mandatory mask usage in the province. We have a long time ahead of us, and I just want to remind all Saskatchewan residents that this is a marathon, not a sprint, and we have some months ahead of us.
We'll take our next question on the phone line.
We have Mark Smith with CTV.
Hi, there's been 72 cases, it looks like, since Friday that have no known exposure links. Is that concerning to public health, and what is being done to kind of address that or look into that?
Doctor?
Yes, thank you. So like I said earlier, from 0 to 5 cases a day with no specific linkages to a gathering or any specific outbreak, we're now seeing in the range of 5 to 10 cases a day. So absolutely we are seeing an upward trend. And so there's a couple of things about that. One is that if we don't find more than one exposure linked to a particular activity, we can't say that this particular activity is the source. But we are seeing, obviously, as more of us are out and about, that if someone presents positive with COVID, in the last 2 weeks, they may have gone to a restaurant, they may have gone to a bar, they may have gone to a small gathering at a friend's place. So all of us are out and about more. And I think that's just something that we knew that, once we resume our normal activities, even if we practice physical distancing, even if we do all the things we are doing, we will see some increase in COVID transmission, which we are seeing. The important thing, of course, is obviously to prevent large outbreaks or clusters. So that's the caution around gathering sizes and other large group events. And obviously all the special cautions we take around funerals, for example, where we again see the occasional transmission happening. But of course, the other thing is that if this trend continues upwards, obviously more consistent mask use is going to be another important tool, another layer of protection. But we all have to, I think, rethink what we do on a day-to-day basis. Enjoy certainly the opportunities we have, but keep our numbers of close contacts small, keep our gatherings small. I know, sometimes it may be an important reason to have a larger gathering, which is allowed this year and not delayed till next year. But I think we all need to just be very thoughtful about what we're doing, how we're, going out and about. And we'll have to monitor that. Right now we've seen our case numbers from 0 to 5 to go to maybe 5 to 10 a day, and due to, a variety of exposures that we expected to see. We'll just have to keep monitoring that, see if there's any specific trends that we need to provide some feedback in terms of guidelines or other advice. But right now it seems to be interprovincial travel. It seems to be, the occasional link to a restaurant or a bar where you don't find more than one case. So you can't absolutely say this is the reason But people are out and about more, and our assessment is that it's exposure is happening in a variety of settings. Thanks.
Follow up, Mark?
Yes. Some communities, including one First Nation in the south, have implemented their own security regulations in terms of who's being permitted to enter. What are your thoughts on these measures being taken?
I don't know if I know we've talked and to a number of communities. Warren, you may have a comment on this, whether it be Indigenous or otherwise. We're talking with Hutterite communities right now. We talked with a number of northern communities earlier through this on whether it's a restrictive access or what exactly the security measures that are in place. But we would continue to, obviously, in the case of Indigenous communities, there's some federal involvement in how their governance occurs. But I would say to date, the conversations that we have had with local leadership across this province have been quite collaborative, and information has flowed back and forth quite freely with respect to what the public health orders recommendations are, B, our understanding of how this virus is spreading, and that understanding evolves over time, and we're as society, we're getting better at controlling the spread of this virus. We're not perfect yet, but we are getting better. So I think the relationship has been quite collaborative. Have you talked with any Indigenous leaders recently on any measures they have in place?
Certainly, and certainly they're very respective of the public health and the chief medical health officer's recommendations. And I think that's the most important thing, is that are they complying with what the advice has been given by all of those entities, and that I think is first and foremost, and what everybody's concerned about, and that's what we're seeing. The majority of our communities are certainly complying with those orders and with those guidelines that are put out there.
We'll take our next question on the phone line.
We have Kyle Benning with Global.
Hi there. I did some addition here, and it looks like 86. There have been 86 cases on colonies out of 110 over the last 3 days. Just given what we're seeing here with the outbreaks at Hutterite colonies and what we saw earlier with colonies in the northern part of the province, is a re-education campaign needed to at a point before we get here, just when maybe there's 2 or 3 cases in a certain community, public health officials can go in there and educate the public about what needs to be done so it doesn't get to this point?
Well, I think that's part of what we are doing in this case, in the case of Hutterite colonies over the course of the coming days, is public health will be reaching out to each and every colony, whether they have cases or not, across the province to, as I said, publicly talk about the public health orders, the recommendations that are in place, to offer testing if it's required or desired, but 3, also to open up the discussion around is there any other supports that may be necessary, in particular for those communities that may be affiliated with or have actual active cases occurring. We had, and Minister Kading was very central to the discussions in northern Saskatchewan, and us providing various supports through the health authority, through the Saskatchewan Public Safety Agency into that community. The supports may be different this time, as you say. First among those is the public education and the public communication around the health orders, and it's proven to work. And maybe you just speak a little bit to some of the earlier colonies that saw cases, and not with specifics, but where they're finding themselves today.
Right. What we've again followed up with a few of our early colonies that had the virus detected in them, and now we're down to 0, maybe 1 active case that's left on the colony. And again, you follow up with them as to what did they do to get to that point, and they followed all of the public health guidelines. They followed what their SHA folks had been telling them, and now they're on the backside of having no more positive cases in their communities. Very much like what we saw in our northern communities when they followed public health orders, they asked for help, we provided help, gave them guidance to get to that end result of getting no more positive cases there, and we've seen that positive result now showing up in some of these early colonies, as we did with some of our early northern communities as well.
And so now we're sharing some of those innovative solutions with other communities across the province. Listen, this is about, in many cases, just doing business a little bit differently, living just a little bit differently, and it works. It's proven to work time and time again, and we just need to continue, as you say, re-engaging with our public education, not allowing this pandemic fatigue to set in. We need to be vigilant with this virus. It's not gone.
Follow up, Kyle?
Yes, but I guess can anything be done from a preventative measure so we don't reach these numbers from different communities, whether it's working with them before any cases take place or early when there may be only one or two cases in that community?
And that is what we're doing. As I said, public health will be visiting in the coming days all of our Hutterite communities, whether they have cases or not. With just that in mind, is there a way for us to share some of the innovative solutions, innovative ways of doing your daily chores, your daily tasks, living your daily life that have worked in some of these communities that have had some of the earlier infections. Let's get the prescription out ahead of the virus, if you will. So you're exactly right. That's what public health is doing in the coming days with all of our Hutterite communities across the province. And this isn't to in any way stigmatize or call anyone out. This is to provide the information in advance so that maybe we can prevent COVID-19 from entering their community. And again, I just thank all of the Hutterite leadership across this province and each of the individuals. They are making an effort. That effort is working, and we want them to know that we're going to work with them right through to the end of this.
We'll take our last question on the phone line.
We have Britton Gray with CJME.
I was just wondering, last week you said something about farmers markets possibly being deemed essential for the Hutterite communities. I was wondering if there has been any conversations with the leaders about going to farmers market and all this while they're currently dealing with this pandemic.
Go ahead, Warren.
So a number of the Hutterite colonies that had been participating or active participants in farmers markets have just voluntarily decided that was just not an appropriate way to participate at this time. So they have voluntarily taken themselves out of farmers markets. I know a number of communities have also canceled their farmers markets, just understanding the risk that might be associated with them if they couldn't take all the appropriate measures that might have been needed to protect the safety of all their customers or consumers there. So we're certainly seeing a number of the colonies in particular just recognizing the risks that's associated with that and taking their own voluntary measures not to participate at this time.
I would urge all Saskatchewan residents, if whether you see an individual that's from a Hutterite community at a farmer's market or in a grocery store or anywhere else, you should not automatically assume that they're from a community that has active cases. Many of our communities, the majority of our Hutterite communities, do not. In no way, shape, or form should you assume that they are in any way, from a community that has active cases. Warren, Minister Kading can, testify that the vast majority, virtually all, I think actually all communities that do have an active case have put in place very, very stringent measures. And so in no way, shape, or form should we stigmatize or assume the unknown when it comes to, our daily interactions. And I would ask all Saskatchewan residents to treat one another, whether you're from a Hutterite colony or not, with exactly the same respect that you expect to be treated with in return.
Follow up, Britton?
Yeah, so next week you said the announcement is coming or for schools and everything, but I guess ahead of that, what concerns are there about with schools possibly opening?
Well, Dr. Shahab, I can make a quick comment, and Dr. Shahab might have some other comments as well. I think we are moving forward with opening our schools here in the province, given the current circumstances. This is an attempt, an effort to ensure that we can get back to some degree of normalcy. In saying that, there's going to be a number of changes. I've said a number of times here, the the public health had put forward some parameters around the safe operations of schools. The school divisions had then taken those parameters and looked at their individual facilities and put forward their plan for the safe operation of classrooms this fall. That plan is now being looked at by the Education Response Planning team and will be returned very shortly back to the school divisions so that our teachers, our educators, our school bus drivers, our parents can all plan and have this plan in advance so that they can plan for what classroom attendance will look like this fall. The Education Response Team is, yes, some ministry folks on it, but also the Saskatchewan School Boards Association has representation and the Saskatchewan Teachers Federation, as well as some other organizations that are involved with our education sector. So first and foremost, we want to have a safe plan for our children's return to the classroom and for the staff that are going to be in that classroom alongside with them. That being said, our goal continues to be just that, but we are ensuring that this plan will have mechanisms in place that will be able to respond to any future public health concerns that may be identified by Dr. Shahab or by specific communities across the province, and mechanisms that will ensure that we have plans in place that keep everyone safe, regardless of what the consequences that may arise. As we've seen, I said the last week, things change rather quickly with this virus. So we will have mechanisms in place that may address a challenge that we might have in one community in the province, but isn't affecting all of the schools in the province. And so they're working quite diligently on, what a safe return to the classroom looks like, and then any mechanisms that may be required to ensure that it's as safe as possible as we move forward. So quite confident that the Minister of Education and Dr. Shahab will be able to release some of the details around that plan in sometime next week. Dr. Shahab, anything to add to that?
Yeah, the only thing I would add is that, it is coincidental that as all the sectors are reopening, summer and schools are not reopening. So I think there should be no assumption that just because schools are opening well after phase 4 reopening, schools are intrinsically riskier. I think if, all this had been happening in the fall or in the spring, the reopening phases, schools would have been earlier to reopen. So, just because, the rest of the sectors have reopened while it was summer doesn't imply intrinsically that schools are higher risk. Having said that, once schools open, obviously public health will continue to work closely with schools. And as I've said before, what we have already learned from, Southeast Asia and other settings where schools have been open in their winter, which is our summer, is that even if you have high transmission in the community, the transmission is not automatically linked to schools or does not automatically result in high transmission in schools. So even if we see increased case numbers in a local community, it doesn't automatically mean that schools have to slow down and pause. In fact, all the other things that we've been discussing earlier today, that physical distancing, caution around gatherings, small private gatherings, more mask use when we're out and about, those are all the things that will have to continue to be a priority, and that will allow schools to continue to, operate as normally as possible. But of course, if we do see the occasional case, and even there, most of the recent evidence has suggested that even when staff are in a school setting and have COVID, they are more likely to have been exposed to others in the community, not in the school setting. So we will obviously be applying all those learnings as schools reopen. But I think it's really everything we do on a day-to-day basis that will allow schools to continue to remain open and other activities to continue as we practice all the cautions when we're out and about, physical distancing, mask use when indoors. And again, mask use does not apply to younger children. And so schools, will have a different approach. But as we are in indoor spaces and other settings, that's where mask use has shown more benefit rather than in the school setting. But those details will continue to be developed, and some of the guidelines will have to be changed for example, for the high school setting if there's increasing community transmission. But at this point, all the evidence and all the experience from other jurisdictions shows that schools, just like daycares, have not been an issue in Saskatchewan over the last 5 months. Schools are not the issue when there's community transmission, but of course they need to practice certain enhanced precautions around children not going to school when unwell, staff not going to school when unwell, and some enhanced attention to hand hygiene and cohorting of students within a classroom and avoiding large assemblies. Thank you.
And that concludes our time for today. Thank you for joining us.